A year of the pandemic has given the virus ample time to spread unchecked across the vast African continent, from the epicenter in South Africa, which has documented more than 1.5 million cases, to even the furthest outreaches, like the remote island nation of Madagascar. The Indian Ocean nation far off the African coast has seen a rise in cases and in deaths, its health minister said.
We have the virus, which is the South African variant, and this second wave. Also, this virus has a particularity. It triggers more severe forms, hence the increase of deaths in Madagascar currently.
Africa has suffered fewer cases than the rest of the planet, but its lack of infrastructure, financial challenges, and its high burden of HIV makes everything that much harder. In Ineswatini, the tiny southern African nation, the health minister told VOA last month they would soon begin a mass vaccination campaign, several months after developed nations started theirs. But in a bit of good news, Health Minister Lizzie Nkosi says they found HIV-positive COVID patients did not fare as badly as they had feared.
And what we've learned, not just us, but across the world, is that HIV turned out not to be such a major factor. It is a factor, but in terms of the people that get severely ill and the people that we've lost, I mean, from our death audit that we did recently, we found that 82% of the people that have died have had comorbidities, and about 80% of those had either diabetes mellitus, high blood pressure, and the combination of those.
WHO Director Tedros Adhanom Ghebreyesus recently warned countries with youthful populations, like African nations, that now is not the time to relax.
This disease is not flu. Young, healthy people have died. And we still don't fully understand the long-term consequences of infection for those who survive. This pandemic is a long way from over.
COVID-19 has killed more than 80,000 people across Africa. But that number is much lower than the death tolls seen in the US, India, or Brazil. And as Tedros notes, tens of millions of vaccines are headed for the continent. For all the difficulties, Africa may still escape the worst of this pandemic. Anita Powell, VOA News, Johannesburg.